Hello, welcome to You and Your Young Child, a program devoted to early childhood and families with young children. My name is Sheila Biggs. I'm a former county commissioner and a retired registered nurse, spent my whole career in maternal child health. Today we have with us Dr. Kim Williams, a family physician in Salina, correct?
Correct.
Okay. And which clinic are you with?
I'm located at Salina Family Healthcare.
Salina Family Healthcare. Okay, today you are here to talk about something called the ASQ. What does that stand for?
So ASQ stands for Ages and Stages Questionnaire.
Okay. And why is this important?
So the Ages and Stages Questionnaire, it's a screening tool designed for young children ages 0 to 5.5 years.
Okay.
And it's designed to screen them for developmental delays.
Okay. Back in my day, when I was doing some Can Be Healthies here in town, I did the Denver Developmental, something that I had to administer. Who administers the ASQ?
So our clinic also did the Denver Developmental until about a year ago, and then we switched to the Ages and Stages Questionnaire. So the questionnaire is 30 questions, and the parents actually answer the questions, and then the medical provider goes through and scores it and kind of places a child in 3 different categories, either developing normally, or needs more monitoring, or requires further evaluation. Okay,
very good. So how is this administered? The parents do it, so
at our clinic, we see children for well child checks, kind of regular intervals, a lot during the first year, a little bit less during the second year, and then kind of yearly after that. So when the parents come in, they're handed the form at the front desk, and then while they're waiting on the doctor, they go through and mark the questions. And each question is a developmental milestone, and they say, yes, my child is doing that, sometimes, or not yet.
Okay.
And so then once they're finished with it, the medical provider that they're seeing for that day kind of looks over it, does the scoring process, and then we'll talk about it with the parent.
Yeah. My daughter lives in Rochester, Minnesota, and the health department there sends this out to the parents, and you send it back. So I have seen this questionnaire a couple of times now, and are some of the questions the parents were unable to answer because perhaps the child's in child care a lot and they're unsure whether they're doing it?
There are some questions that they're not sure how to answer, and we say answer to your best ability, and they can just skip it. As providers that score it, we're instructed if they skip it, they don't get credit for it necessarily. But sometimes that's why there's that gray zone. So if they fall in the gray zone, we can talk about, well, I've never seen my child do that, but maybe they can. And then they can kind of look for that as they leave the clinic.
Yeah. That's something that I noticed when my daughter and I were kind of looking at the questions and looking at, she says, I'm not sure she does that. And so we just watch. Yeah. And pretty soon if you're observant, if you know what you're looking for.
Yeah.
Yeah. So I think she's done it, but I don't know.
For example, one is as a kid gets older, they're supposed to be able to throw a ball overhand. If the kid's never had a ball to throw, maybe they can, but they just haven't observed it. So it's things like that we say, well, go home and give them a ball and see what they do with it and see if they can.
Right. So so parents should not worry about that kind of thing as they're filling it out for fear that something's going to show up with their kid that.
Correct. Right. It's better not to make up, well, yeah, I think they can. If you don't know, just leave it blank. And then that just lets the doctor know that maybe you haven't had a chance to observe it yet.
Okay. Okay. So if a child doesn't pass the screening, so if they fall into one of the middle area, let's say, what do you do with the middle area?
So in the middle area, we talk with the parent and, like I said, kind of see if maybe they haven't observed those things and to go home and look at them. There's also the Ages and Stages comes with an activity sheet for each age, so you can give that out and say, here's some things to work on, and go home and try to work on these things, and let's check back at the next interval. Now, kind of depending on how old the child is and what the concern is, we may follow that child up sooner than we normally would have otherwise and do a screening again at that time. Or if there's multiple areas of concern, it may be at that point that we say, I think even though this didn't look and there needs more evaluation, I think because of looking at the picture as a whole that we need to do further evaluation, and we might refer them on.
Okay. So if they fall in that last category, the needs evaluation, what happens then?
So at that point, as a medical provider, we refer on. So the Ages and Stages questionnaire is just a screening tool, and with any screening test, that means it tries to find people who might fall out of the norm. It's not diagnostic. If your child says needs further evaluation, it doesn't mean that there's a problem, we have to do something right away. So we refer on for further evaluation.
Okay.
And in the state of Kansas, from birth to up to 3 years, once they turn 3, it changes a little bit, and I'll talk about that. They go to the Infant Child Development Program.
Right.
And in that program, they have an intake assessment. They do a much more thorough evaluation of development. They can take more time with the child. They'll bring in speech therapy, maybe physical therapy, occupational therapy, to kind of assess how the child is developmentally. Once they hit age 3 and then up, then it goes through the school system, and they have those same resources through the school system with speech therapy, physical therapy, that sort of stuff, to do further evaluation for a child.
Okay, very good. And how many children are referred every year in your practice?
Well, we ran our numbers for the last year, and we had about 42 that were referred out of the last year.
Okay, and out of how many?
Oh, I have no idea. We see a lot of kids. Yeah, I don't know. I would say, I don't know if that's maybe 10%. I don't know.
Okay.
So,
okay.
Yeah.
Okay, and we have had some people from these other referral, the places you would refer on, tell what they do. They do home visits and some clinic visits and a lot of different things. Everything's kind of individualized.
Yeah.
Once a child is referred, do you quit doing the Ages and Stages, or do you continue on?
No, we don't quit. So, you know, we kind of take that into account when we see them the next time, because oftentimes kids are delayed just in one area. So I didn't mention that the Ages and Stages evaluates 5 different areas. Okay. And I'm going to...
You refer.
Yes. Okay, so communication, gross motor, fine motor, problem solving, and then personal social are the 5. So it could be that a kid is referred in one area, maybe communication. And I would say that's probably our most common referral, is they have some sort of speech delay or, and so.
And speech is so hard.
It is, And so they're referred in that area, but we need to continue to monitor their progress and then also monitor the other areas.
Because it wouldn't have been referred in that area.
Right, and so then when Infant Child Development does their assessment, they say, oh, you need speech therapy, but you don't need physical therapy or occupational therapy. So they don't, you know, obviously they're seeing the child regularly, they kind of evaluate it, but not in a formal evaluation. So we continue to monitor those.
Okay. Well, that is just all kinds of wonderful information, Kim Williams. Thank you very much for coming over and talking with us today. Any other comments or anything that you would have on this?
I don't think so, and I'm glad to hear that, you know, Infant Child Development has come. I have a son that was in speech therapy through them, and they're just a wonderful program and give parents lots of ways to encourage their kids. And, you know, often these delays are just small delays, and you can get them caught back up pretty quickly.
Correct, and I think that that's one of the most important things, is that back when I was working, we always said that people have the shoot the messenger syndrome sometimes, that when a child has a problem, parents don't want to hear it. They think that that's going to label their child forever, and it doesn't. We have seen that if kids can get help early, which is why we start this early, they can overcome all those kinds of things and be perfectly up to snuff and ready to go when they enter kindergarten. But it's very, very important to discover this early.
Yeah, and they've shown over and over again with many different kinds of developmental delays, the earlier you can get intervention, the better kids do getting ready for school and then long-term overall. Okay,
all right. Thank you very much. And as always, we ask you to please look at our website, DickinsonParentsConnect.org, for more information. And thank you for coming.
Thanks for having me.